It turns out that the prognosis for many prostate cancers is quite excellent. And because of that, you as the patient actually have a lot of options for what you want to do. Typically, the two main types of doctors you talk to is a urologic surgeon as well as a radiation oncologist. Sometimes you may be recommended to also speak with a medical oncologist as well, depending on whether the prostate cancer is in the early stages or in a more advanced stage. And some of the things and some of the topics that should be covered in these conversations. One, we should be establishing what risk group is this prostate cancer in. So a lot of treatments in the United States are driven by the prostate cancer's risk group, right? We have low risk, intermediate risk, and high risk. And in each one of those categories, we further subdivide it. We really try to pick the right treatment option for the risk group where it is. We have different treatment options that we may talk to you about. We have active surveillance, which is where we say this is a very low risk prostate cancer. We think at some point you may need a treatment, but that may not be for another 5 to 10 years. So we're not going to forget about it, but we're not going to put you through all of the treatments right now. Or you have your two gold standards. You have radiation therapy and you have surgery. If it's a more advanced cancer, sometimes we may even add on what's called an androgen deprivation therapy, or ADT, or some folks may just call this a hormone therapy, and that can be used to help improve outcomes for prostate cancer. So in these conversations, you may be offered a second opinion on the pathology report. You may be offered additional imaging, such as MRI imaging, or what's called a PSMA PET scan, or a nuclear medicine bone scan. These are all things that are used to establish where the prostate cancer may have gone in the body. Is it still just in the prostate, or has it traveled into the lymph nodes or elsewhere in the body? And our treatments that we recommend you really depend on exactly where the prostate cancer is. So some patients may get a little frustrated when they come into the doctor's office and say, well, just tell me what to do. But I think if you have a good doctor here in the prostate cancer space, they're going to do what I call shared decision making. They're going to sit down and say, look, there's a lot of things that we could do, and there's a lot of options that are available to you. Here's the pros and cons of each. Which one makes sense to you? What side effect are you most concerned about? Are you most concerned about incontinence? Are you most concerned about urinary urgency? Are you most concerned about a long hospital stay? What is it what makes up your concerns? And we try to match you with the best treatment.